Hello there. Thank you for joining me. My name is Lisa Vasile, and I'm a nurse practitioner working with For Better Health in Hopkinton, Mass. Thank you to Joint Effort for having me on today. So when they reached out and asked if I would do a little talk, I thought, well, what would the listeners potentially want to hear about? And anything but COVID. I thought it might be nice for us to have the ability to share what functional medicine is, because some of you may or may not know, and also to share a little bit about the difference between how we might approach the top 5 chronic conditions or health conditions in the U.S. And so let's get started. And hello to those of you that are joining in and all the little comments. Thank you. So I just wanted to start with, again, who I am. So my name is Lisa Vasile, and I'm a functional medicine nurse practitioner. So what is functional medicine? Functional medicine is getting to the root cause of why somebody's body is out of balance or in dis-ease. We don't usually call it a disease. We say the body's in dis-ease. And so typically that comes from a body balance issue. There's something out of balance, or there is, hi Giovanna, or there is something more burdening the body. And so we look to see what is the root cause of what that might be. And let's give a quick example. So somebody might have an issue with high blood pressure, and the medication is highly important, but it's not a deficiency of that blood pressure medicine. So what is causing the blood pressure to be high? Or for the same reason, somebody's maybe blood lipid levels, the cholesterol levels, or maybe somebody is also having the same issue with constipation. And the medications are helpful and needed, but that's not what the body is actually asking for. And when when the body gives a symptom, it is not a deficiency of that medication. And so in functional medicine, we look a little deeper and try to find out what might be adding to the body's dis-ease or what might be missing that the body needs. And so in doing that, it really helps to empower the patients, because quite often you go to the practitioner and you say, this is what I'm experiencing, and they say, try this medication, and you walk away with a pill. And that's helpful, thankfully, but there's no education as to what could I do that might be able to slow this process down, or maybe is there something I could do that I could change the way my body's reacting and not necessarily need that medication long term. And so in functional medicine, we like to think of the word functional as optimizing the function of the body, right? So many times we are told you have XYZ. So that might be diabetes, or for me, I have celiac. You have XYZ. And so you take this medicine or don't do this. And there's not enough time a lot of times in traditional medicine for education or inspiration or empowerment to the patient. And so that's where we really excel with functional medicine. We like to think about ways to bring the body back, like I said, to body balance, but also to reduce symptoms. And that can be done with medication, or it can be done with lifestyle, which is a huge piece of how we work. And in general, most of what's happening in our body is a response to inflammation. And so inflammation, we think of, oh, I rolled my ankle and now it's swollen and there's inflammation there. Or maybe you bumped your arm and that's now swollen and red and there's inflammation there. Or even if you got stung by a mosquito and you're one of those people that gets the big welts, that's what people think of as inflammation. But they don't necessarily think of something that they can't see inside their body as inflammation. And so when you think of things like, I've mentioned blood pressure and cholesterol and even constipation or diarrhea, or for some people, we'll get into some of these conditions. Inflammation is usually the biggest driver. And so let's talk about what that means. And so first, let's talk about the top 5 health conditions in the U.S., those health concerns that are driving many, many people to either miss out on fun or have high concerns, anxiety, worry, because of what they're experiencing or what they've been diagnosed with. And then also let's talk about what those statistics look like, because I think some of us know, most of us know somebody that has XYZ, like I said, high blood pressure, high cholesterol, or diabetes. But maybe we don't know the actual level of how much that, what that looks like as far as statistic. And so I want to quickly go over some of those statistics. The first one would be cardiovascular disease. That's the number one health condition in the U.S. 1.6 million adults over age 20, yes, 20, are living with heart disease. Isn't that terrible? 1 in 3 people will die yearly from this, and it encompasses those who have high blood pressure, high cholesterol, and heart attacks. But weirdly, it does not encompass in the statistics that are typically written up strokes. And really, strokes are a secondary for a lot of times. Sometimes it's more blood clot related, but other times it's because of cardiovascular disease, is another 780,000 people. So all combined, that's about 18 million people yearly who are dying from heart disease. And this is an inflammatory disease. So let's talk about that as we go along. Many people don't really think about cardiovascular disease as encompassing blood pressure or hypertension is what it's called. But that's also one of the biggest drivers, and that's 103 people in the United States that are living with high blood pressure. That's nearly half of the US population. Sadly, though, only half of those are actually optimally treated so that their blood pressure is in the range that is not going to cause an inflammation process in the body leading to some of these other conditions. And that would be a blood pressure of under 130 and under 80. So the top number under 130 and the bottom number under 80. And so sadly over time, that pressure, that push, that pressure of the blood going too quickly and too much through the body, the vascular system and some of the organs are affected by that. And that's what we call inflammation. The second one is diabetes, or the sugar, if you're from Massachusetts. We got the sugar. This statistic is one of the most concerning because it's raising drastically. Like every 5 years, it keeps huge jumps. So in 2015, 26 million Americans were diagnosed, but in 2020, that 26 million jumped to 34 million. And then those that were not diagnosed, in other words, they hadn't had blood testing done to even have the diagnosis, went from 9.5 million up to 11. And here's the trick, the big one. The pre-diabetics, those people that were diabetic, but their numbers aren't normal, but they're not considered diabetic yet. So we call those pre-diabetic. In our world, we call them insulin resistant or not able to use the insulin. But also, without education, inspiration, empowerment, like I talked about, people are going to just basically become diabetic, right? And all of a sudden I have. And that pre-diabetes is a huge piece where we can reverse that inflammation, change lifestyle, and really stop that from actually happening. You can reverse it for sure. And that statistic went from 90 million 5 years ago, and now it's up to almost 100 million Americans that are pre-diabetic. So huge, 140 million people, 3% of this stat is under age 20 that are walking around with a condition that is leading to heart disease, stroke, kidney failure, eye failure, losing limbs, etc. And so diabetes, as you know, is a condition where someone's blood sugar is elevated and chronically elevated. The insulin is not coming from the pancreas, or it's not working well with the blood sugar to get it out. That becomes inflammatory. And what people don't know, one of the statistics down the road, the next statistic is dementia. And so dementia is 5.7 million people in the U.S. And sadly, this statistic is rising just almost as quickly if you look at percentages. And so by 2030, which is only 10 years from now, that statistic is going to go from about 10 to about 70 million people. And what they're calling dementia now is type 3 diabetes. So many people don't know how inflammatory having elevated blood sugar is, and what we're eating every day may be causing some of these other chronic conditions, of course, inflaming the body. And so the other piece with diabetes is that it also increases the risk of, the info sounds good, but I can't get the sound loud enough. Oh no. Is everybody else having trouble hearing me? Give me a thumbs up if you can hear me. Hopefully this is better. As far as the diabetes also leads to an elevated in triglycerides. So people think of a triglyceride as a cholesterol, but it's also, unfortunately, this is a blood sugar test in our eyes. If you can get those numbers down quite a bit with some of the lipid lowering or cholesterol lowering statins, medications, but many times that doesn't necessarily affect the triglycerides because you have to change your lifestyle, you have to change your diet in order to get the liver to process the triglycerides properly. So we look at that as a blood sugar marker. And so that increases in those who have diabetes have a 2 to 3 times increased risk of dying by heart disease. 3 out of people with diabetes also have high blood pressure. So these are all sort of intertwined. We know about the obesity statistic, which would be the number 4. 72% are either obese or overweight, and that's 1 in 3 Americans, which it's not about size, it's about the inflammation that happens when we have that extra weight. It's the work on all of these other organs that we've already discussed, but it's also a cortisol inflammatory processes. The adipose tissue actually adds inflammation to the body by markers such as, try increasing the sum, hold on. Oh, okay, yeah, so that's for somebody else. And so then the last one is mental health. So I do want to make sure I touch base on this because 43% of Americans in the U.S. are living with mental illness, 63% have serious illness, and 51% of those are 6 to 17 years old. So sadly, not only is that just devastating because we have such issues with mental health, and I think it's huge for me to for all of us to make sure that we're paying attention to this, because especially right now with so many people isolated, but all of the behaviors that come with mental illness, unfortunately, are increasing those other statistics that we've already talked about. Struggling with mental illness increases the risk of all of those conditions, but it also devastates the 10th leading cause of death, and leading to about 50,000 people dying. So it's a huge thing. And when people look at that, they think, well, Lisa, that's not got nothing to do with diet, it has nothing to do with exercise, it has nothing to do with inflammation, and quite opposite, actually. I'm not saying that you can fix somebody who's severely depressed by eating kale, but for sure we know that the change in the way that you eat changes the microbiome, which is the gut bacteria, and the gut bacteria actually help to make and support optimal neurotransmitters, which is how we work with our brain and how we work with our mood. And that also helps with sleep, all of those neurotransmitters. So all of those are connected, and so 100% exercise and being outside does help the mood. And we know that joy and everything. So that leads to the next section. So yes, some of this is genetic. I'm going to get that question. Well, everyone in my family has XYZ, and that's of course true. But everyone in your family might be doing the same behaviors or eating the same food, have the same stress, or live in the same environment as far as where you are in the world, what you're doing stress-wise, climate, sun, vitamin D, etc. And so when we look at how to optimize health and support lowering inflammation, we look at a gamut of things that are in your control. And that's what you're putting in your mouth. Most of us put something, food or liquids in our mouth about 10 times a day. And not only is that important as to how that's working with blood sugar and cholesterol, etc., but it's also what your microbiome is doing with that and whether or not it's going to increase inflammation or decrease inflammation. And so think of it as a bank. Am I taking a withdrawal, or am I putting in a deposit? And I'm not saying that I'm perfect. 80-20, go for it. But when I'm making my choices, those choices are what's going to happen down the road. And if you feel crappy after you eat something, that's a huge sign that your body is inflamed. So think about it and think, well, maybe I could have less of that or have it less often. We also look at not only what we're eating, we look at what the ingredients are. Chemicals in food, try to avoid things that you can't understand or spell, things with a bunch of food dyes. Absolutely avoid high fructose corn syrup because it turns into mercury in the body. And of course, if you can, really try to avoid anything with the trans fat. Trans fat, anything that says partially hydrogenated or hydrogenated, avoid it. Now, there are some people that really truly in our world look at something called gluten, which is something that wheat, barley, and rye make in our body. They use it to keep it all sticky and yummy and fluffy, for those of you that love your gluten. But it can be inflammatory, and it can cause things to be a little out of whack with diabetes and high blood pressure and inflammation in the body. Is for sure dementia in brains and things like that. We also don't necessarily always look at diet as much as we're looking at nutrient levels. So many of us maybe had a B12 or a vitamin D or an iron checked, and that's probably the gamut that you get checked if you get it checked. But what we're not looking at when you're getting your lab results, we beg you to look at your results and see where you are in the reference range. So if the reference range for D is 30 to 100 and you're 30, that's like a D minus. So if you are checking an iron, we recommend checking a ferritin level, which is the iron stores, because that's actually how you're going to utilize that iron. If someone with a B12, normal is say 190 to 1100. Well, if you and your child were sitting together at a table and they came home with their grade of a 190 on their chemistry test, would you be happy? No, you'd want them in the 700-800 range, right? So your body, little teeny tiny pieces of these nutrients should be at optimal level to all work well together and work in sync and to make you feel as vibrant and optimal as you can feel. We recommend everybody asking for our nutrient levels. And if you do that, make sure that before you go, you stop any vitamins that have vitamin D or B or zinc or iron or anything like that for about a week before you go, so that they're not testing your supplement, they're actually testing your level. And so we would recommend things like RBC zinc, which is a 3-month average, or RBC magnesium, 3-month average. If your doctor won't do that, then do the regular. Then you could do, or your nurse practitioner or your PA, whoever's your provider, you could do things like an iron. We would recommend a whole panel with the ferritin, a B12, a vitamin D. Those are just some easy ways to look at nutrient levels and make sure you're optimizing to you. Not everyone just popping a bunch of pills because they saw it on Dr. Oz. And lastly, we actually would like everybody to look at their inflammation levels. So CRP, or C-reactive protein, is a way that you can look at that, and that should be well under 10. It should be single digits. That's homocysteine. CRP should be under 1, and it should, if it's over 3, then that's higher inflammation. If it's over 10, that's very high inflammation. And not that it's going to cause a heart attack, but it's systemic, cumulative, recurrent inflammation that's having issues in our body and can cause things down the road. And so the other one, if you are struggling with any kind of high blood pressure, statin, or blood sugar issues, we recommend a homocysteine as well, which is an inflammatory marker. And again, that's the one that should be under single digits, under 10. And these markers are paid for by insurance if you have the diagnostics of the inflammatory processes we've talked about. And then looking at sleep, people discount it like it's no big deal, but it is when you detox, it is when your body resets, it's when your pancreas insulin reset. It's hugely important. So if you're having trouble with it, you really need to work on that. Ask the provider for help, do some meditation, shut off the screens 20, 30 minutes before, or use the blue light glasses. Really work on this, because it's a huge game changer when it comes to lowering inflammation in the body. Looking at stress, sure, we're all going to have it, especially right now, but really trying to find a way to actually export it. So again, yoga, walking, hiking, laughing, comedies, reading, journals, meditation, qigong, whatever you can do to purposely say, I'm going to export this. Some people will say, well, I exercise every day, and that's great, because I think the statistic is 1 in 4 Americans and 1 in 5 children get enough exercise. That's what the statistic is right now in the US, so that's not very helpful for these chronic conditions. So we want to optimize that, but sometimes excessive exercise can actually increase inflammation. So you just have to make sure you're balancing that. And with that, you have to have joy. And so if you're not doing something on a regular basis to add joy, it's that body balance, body burden thing where you really aren't balancing out the amount of stress that we have. And then lastly, overexposures to some of the chemicals that we're exposed to. Sometimes you don't have a chance or any kind of a way to avoid those, but things like what are you using to clean your house? What are you using to wash your face or in the shower, wash your hair, put all over your body for lotion or makeup or creams or eye creams or whatever it may be. I think the statistic is that women, when they're not at home in their pajamas every day for quarantine, women are putting about 30 products, using about 30 products per day before they leave the house. And that's between brushing your teeth and washing your hair and washing your body and soaps and lotions and potions and makeup and hair products. And so you can imagine that after year after year after year, that's cumulative. And so you need to make sure that you're looking, we recommend looking at these products and saying, what can I change out that isn't going to affect the quality of what I want it to do? So for some, like me, my hair products, I know there are some that are good, and I try to use the ones that are less toxic, but sometimes the control is better with some of the craps. But that's a teeny tiny bit compared to everything else in my house that we've changed out completely. Even shower curtains, we took those out. They're plastic, they're terrible for us. What are you putting in the dishwasher? You open that dishwasher, blast of chemicals. Things like that you can think about on a regular basis. Next purchase, you go ahead and you buy something that's less chemical driven so that your body has less burden. Things like, again, I mentioned what you're eating. Can you read the ingredients? Can you try to eat foods that are basically non-UPS labeled, right? So things that are in the way that they came when they were grown, whether that be an animal, a bird, an egg, or vegetables or fruit. And then you don't have to worry about what else is in it. Less boxes and cans. And if you're going to eat those, because you have to, affordability wise, try to get the ones that have the least amount of ingredients and the ones that you can actually understand so that your body knows what to do with it. You can optimize nutrition, lower that inflammatory processes that the body does on purpose to support you and help you, but you don't want that level of inflammation higher because it does lead to a lot of these other conditions. And I've had people do something like a Whole30. They do it to lose weight, but when they do it, they're like, I lost, 10 pounds in the first week. And I'm like, that's inflammation. You took out the highest 5 inflammatory foods, which are gluten or grains, dairy, alcohol, sugar, and then processed food. You take those out, you're going to eat regular food. After about 10 to 14 days, the body's like, whoa, I know what to do with all these food. I understand them. And then you just shed weight. And a lot of it is inflammation. My headaches went away. I could sleep better. My joint pain went away. My rash went away. And they're thinking it's because they're losing weight. But in reality, it's because they've really reduced some of these inflammatory foods and some of the chemicals that come with them. Let's see, what else did I miss? And prescriptions. I'm not saying the prescriptions aren't important. We prescribe in our office, but what are they doing and how can you optimize your body when you're taking them? So something like a statin reduces CoQ10. Metformin for blood sugar reduces B12. So what are you doing to try to optimize what might be reduced or the balance of the body, but also what can you do when you're taking these medications to help your body to get them to not only absorb them but excrete them properly so that you're not storing things. And also looking at the ingredients, right? So some prescriptions are just like, oh, just take a prescription. But I have patients that say when the insurance changed it to this other one, I had issues. And then I'll look it up and it has a food dye or a chemical in it that their body just can't handle. So pay attention to that. And that brings me to the over-the-counter things. People don't even think about over-the-counter as prescriptions. They think that they're just, well, it's over-the-counter. It's easy. It's free. It's not going to do anything. But those can have a lot of dyes and a lot of chemicals. And so you really want to make sure that you're taking them appropriately. And if you're taking them on a regular basis, anything over-the-counter, not like when I say regular basis, if you're taking it more than once or twice a month, anything, whether it be Tums or Pepcid or ibuprofen or anything like that, something to help you poop. Anything that you're doing more than once or twice a month, and if you're doing it once or twice a month for a long time, but if you're doing it more than once or twice a month, that's a chronic condition. You should see somebody and get it fixed because that's your body saying you need to support the body dis-ease in the body. And that's it. That's all I have for you guys today. I really hope that helped to share with you some of the ways that you can reduce inflammation in your body. It's not hard. It's busy, but it's not hard. And you get to the point where if you do one thing, say a week, and you just keep adding, over the course of 6 to 8 weeks, 6 to 8 months, imagine 6 to 8 years, the cumulative bonus that the body gets from that and all the benefits. So thank you so much for having me. Thank you for listening, and I don't see any questions, but feel free to post them below. You can also contact us at info@4, not FOR, but the number 4, betterhealthmedicine.com. So the number 4, betterhealthmedicine.com. It's info@ for the email, and the website is forbetterhealthmedicine.com. Real quickly, somebody said, what about taking fish oil? Well, I can't speak to every single person because I don't know the person's case study. Fish oil in and of itself is a healthy food. It's a healthy fat. So certainly eating fish, right, especially the low mercury fish like salmon, which is high fat, high good fat, but also really good healthy omegas would be great. Now, if you're not I don't like fish, then you could take a fish oil. You just want to make sure that the company is proven to not have, to be testing for negative mercury. But you also have to make sure that you're talking with your provider, because sometimes that can actually shift the way that your blood clotting works. So you just have to be careful. It's not for everybody. All right. Thank you so much. I really appreciate it. You guys have a great day.